Preventing Suicide Through Communication. A checklist for parents and families of people living with mental illness to assist in communicating with treatment providers. The checklist was created by the Oregon Council of Child and Adolescent Psychiatry. Special thanks to Dr. Stewart, Newman, and Jerry Gabay for their leadership on this critical issue. Video by NAMI, Montana. Families with a loved one living with mental illness should ask the following questions of their mental health provider. Has the provider requested that the person sign an authorization to speak with the family? If not, why not? If yes, and the person refused, did the provider explain the therapeutic value of speaking with the family? Has a comprehensive risk assessment, including personal interview with the person, record review, and solicitation of information from the family, been completed by the provider or other qualified professional? Has the provider or any other professional concluded that the person is at elevated risk of suicide? Has the provider reviewed the records of previous mental health providers and communicated with all others who are involved with the person's treatment and care, including therapists, family physician, case managers? Families should offer to provide additional history to the provider and tell the provider what they already know about the family member's illness and need for treatment, especially any episode that suggests the potential for self-harm. When a family member has been identified as having an elevated risk of suicide, families have a compelling interest to ask the following questions. What are the diagnoses and treatment recommendations? How can the family best support the provider's recommendations? Where can one learn more about the illness which has been diagnosed? What is the provider's evaluation of the suicide risk in this case? What steps should the family take if they see these factors occurring, such as taking the person to the hospital for reassessment? What are the particular warning signs, not the same as risk factors, for suicide in this person's situation? Families may wish to ask the provider to help create a plan to monitor and support the family member. What protective factors exist, and how can these be expanded or enhanced for this person? What community resources are available to help the families and the person involved in treatment, including resources for case management, peer and family support groups, and improving mental health at home? What type of ongoing care is required? Who should provide that care? How can the family access that care? What can the family do to best help the person involved with treatment? Is there anything the family should not do? How can the provision of care be coordinated when the person transitions from one level of care to another, or from one provider to another? Families may wish to request that the provider assures that 1. A follow-up visit is in place with a specific timely appointment. 2. That the accepted provider has full knowledge of history and risk issues and records. And 3. That the original provider confirms that a family member has attended the follow-up appointment. If the person suffering from mental illness symptoms and/or suicidal thinking is at university or similar setting, family members should ask the Dean of Students the following questions. What symptoms are in place to support students living with mental illness to avoid self-harm? Is peer counseling available for the student with mental illness? Are health services and/or counseling services on call 24/7? If not, what are their hours? Is there a 24-hour number to call in case of emergency? Is there an office to intercede with instructors for the student who feels overwhelmed or highly stressed? Will use of these resources imperil any scholarships the student may have? You could download the full checklist and other resources at www.ocap.org. Thank you.